Hey, I'm John Michael. What brings you in today?
Just to check out.
Okay, let me close this curtain and gather all my supplies and wash my hands. Okay, now I'm going to measure your vital signs. And your blood pressure is 120/80, pulse 78, respiratory rate is 14, temperature is 98.6, your O2 saturation is 99%. And are you experiencing any pain today on a scale from 0 to 10? Okay. It's a 0, okay, so she has no pain. Her height is 5'2", weight is 135, and her BMI is 24.7. Okay, now I'm going to inspect her for her hygiene, overall appearance, and skin color if it is appropriate for her race, and it is. And then we're going to inspect her for her body stature and nourishment, so we're going to go ahead and have you stand up. And we're also going to inspect her for her posture, gait, mobility, range of motion. Can I have you walk to that door and then walk back, please? Her gait seems fine. She's balanced, smooth. She's able to get around no assistive devices. Okay. Now we're going to inspect her body, her mood and affect, and how she's dressed, if she's dressed appropriately, and her behavior, and she is. She seems to be in a good mood. And what is your name?
Madison.
Okay, and where are you at, Madison?
Jackson.
And what is the year?
2021.
Okay, so Madison is alert and oriented ×3, and by me asking her this, she's able to comprehend, she's able to follow simple instructions by walking to the door. Her voice quality is good, she has good articulation, she can speak, she can hear, and her native language is English. Okay, so now we're going to move in, we're going to start inspecting Madison's head and face. We're going to start off palpating for her skull for contour, tenderness, symmetry. So you have any tenderness? Okay, so no tenderness. So we're going to inspect her hair. We're going to look for texture, the color, distribution, if there's any lesions. And her hair is dry, it's brown, it's evenly distributed, and it's fine texture. I don't see any lesions in her scalp. Okay, so now we're going to inspect her skin for surface characteristics and color, and I don't see any surface characteristics standing out, and it is an even color. And then we're going to palpate for temperature. Her face feels warm, and we're going to also palpate for moisture and tenderness and texture. Do you have any tenderness? Okay. And her skin is moist and dry. Her skin is dry and smooth. And then we're going to palpate the bony structures for tenderness, symmetry, and size. You have any tenderness? Okay. And then we will palpate, or we're going to inspect the facial features for symmetry and weakness, and they're symmetric, there's no weaknesses. We're going to go ahead and get her temporal pulses, and we're looking for presence, regularity, equality, and the rhythm, and they're equal to plus bilaterally. And then we're going to get the range of motion of her TMJ, and we're also assessing for crepitus and tenderness. So I can have you open your mouth, close. Okay, did you have any tenderness? And there's no crepitus, and she had full range of motion. And now can I have you clench your jaw? Okay, and that's testing for cranial nerve number 5. And now can I have you smile, frown, close your eyes tightly, raise your eyebrows, and puff your cheeks out. That's testing for cranial nerve number 7. And the master's was cranial nerve number 5. I believe I said that. But okay. Now we're going to inspect her eyes. So we're going to use the Rosenbaum chart to test her visual acuity, which is cranial nerve number 2. So can I have you cover your right eye, and do you wear contacts? Okay, so this is going to be corrected. So with her left eye, can you read the lowest line?
3, 7, 4, 2, 5, 8.
Okay, can you go lower?
No.
Okay, you can do the other eye.
Okay. 374258.
Can you go lower?
Mm-mm.
Okay, so her vision is 20/30 in the left and right eye, and is corrected. Okay, now we're going to inspect the eyelashes and eyebrows for symmetry, distribution, and color. And they're the same color as her hair, and they're distributed evenly and symmetric. And then we're going to inspect the eyelids. Can you close your eyes? We're going to look for closure, blinking, symmetry, color. And there's no lesions, same color as her skin. And her blinking's good. She has good closure. So now we're going to inspect the conjunctiva and the sclera for clarity and color. And the conjunctiva is moist and pink, and her sclera is white, and they're clear. And then we're going to inspect her cornea for clarity and lesions to the side. And there's no lesions, and they're clear. And then we're going to inspect her iris for shape and color, and it is green and round. Okay, now we're going to test her extraocular movements. Just test for cranial nerves number 3, 4, and 6. So can I have you follow this pin? Okay, and they're symmetric. Her eye movements are symmetric. And now we're going to do the confrontation test for cranial nerve number 2. So can I have you cover your right eye and tell me when you see my finger?
I see it. See it. See it.
Okay, your other eye?
See it. See it. I see it.
Okay. And now, so our peripheral vision is good. We're going to do the corneal light reflex. We're testing for presence and symmetry, and it is present and symmetric on both sides. And now we're going to test for cranial nerve number 3, doing the Perla test. And now can I have you look over my shoulder and then look at this pin? Okay, and her pupils are equal and round and reactive to light and accommodation, so cranial nerve number 3 is intact. Okay, now we're gonna do her nose. So we're gonna start off inspecting the nose structure and the septum, and for symmetry, and it's symmetric. We're going to inspect the nose for foreign bodies and discharge, and I don't see any. And then we're going to palpate the nose for tenderness. You have any tenderness? Okay, there's no tenderness. And then we will inspect the nares for color, swelling, lesions, and moisture. And now we're going to assess for patency. So can I have you close one nostril and breathe in, and close the other nostril and breathe in. Okay. We're going to move to the external ears. So can I have you pull your hair back? In her ear, we're looking for position, alignment, color, symmetry, size, shape. And they are aligned, they're symmetric. We're looking for skin intactness. Her skin and color, and her skin's intact. The color's the same as the rest of her body. For her race, there's no lesions. Okay, and then we're going to look at the external auditory canal for discharge and lesions, and I don't see any in that one or that one. And then we're going to inspect and palpate the ear and mastoid area for tenderness and lesions. You have any tenderness? Okay, there's no tenderness, no lesions. Okay, now we're gonna do the whisper test. Can I have you close this ear? Okay, and I'm gonna whisper something, and you just repeat what I say.
Okay. Bear. Cat. Dog.
Okay, can I have you close the other ear?
Tiger. Dog. Bear.
Okay, and that's test for cranial nerve number 8. And now we're going to do the mouth. So we're going to start off inspecting the lips, buccal mucosa, and gums for symmetry, surface characteristics, color, moisture. So okay, open your mouth. There's no lesions, moist, it's pink.
and they're symmetric. And now, can I have you stick your tongue out? I'm gonna inspect it for position, movement, symmetry, color. It's pink, symmetric, it's moving. She can move it, and it is moist as well. And then we're going to inspect the oropharynx for color, odor, and lesions. It's pink, there's no odor, and there's no lesions. Inspect the teeth for position, alignment, the number, the hygiene, and her teeth are clean. There's 28 of them after removal of her wisdom teeth. They're white, they're aligned, they're straight. And now we're going to have, can you swallow for me? Okay, so she can swallow. Let's test for cranial nerve number 5, 7, 9, 10, 11, and 12. And I can have you stick your tongue out, move to the left, to the right, and now push your cheeks out. Okay, and that's test for cranial nerve number 12. And we're going to inspect the roof of the mouth and the floor of the mouth for surface characteristics and color, and the color is good. There's no surface characteristics. Okay. Oh, we're going to test for cranial nerve number 9 and 10. And we're going to do that by looking at her uvula and pillar movements. I'm going to stick this in your mouth, have you say, well, let me get the slide. Have you say, ah. So they're symmetric, and then by listening to the gag reflex, I would have tested for cranial nerve number 9 and 10. Okay, now we're going to move to the neck and shoulders, and we're going to start looking and inspecting for color and surface characteristics. And I don't see any surface characteristics. This color is even, and we're going to inspect and palpate the neck for symmetry. We're going to inspect and palpate the neck and shoulder for symmetry, movement, and tenderness. You have any tenderness? Okay. We're going to inspect, or we're going to get the carotid pulses one at a time for presence, regularity, equality, rhythm, and amplitude. And they are equal to plus bilaterally. We're going to palpate the trachea for position, tenderness, and lesions. You having any tenderness? Okay. Palpate the thyroid for enlargement and is not palpable. And can I have you put your chin to your chest, back, and to the side, to the other side, and then around. Okay, that's testing for range of motion of our neck and shoulders. And then I'm going to do the lymph nodes. I'm going to do them for the mouth and the neck and shoulders. So I'm going to do the preauricular, postauricular, and we're palpating for size, arrhythmia, edema, mobility, tenderness. So let me know if you have any tenderness. And then this is the occipital, postauricular, preauricular, the tonsillar, submandible, sublingual, and submental. And then the anterior cervical chain, posterior cervical chain, supraclavicular, and infraclavicular. Do you have any tenderness or no tenderness? Okay, and now I'm going to test for cranial nerve number 11. Can you shrug? Okay, so her cranial nerve number 11 is intact. Okay, so now we're going to do the anterior chest. We're going to inspect the anterior chest for color and surface characteristics. Then we're going to inspect it for symmetry, configuration. We're going to look for any heaves, lifts, or thrills. We're going to inspect for retractions, paradoxical movements, or sighing. And we can have you lay back. We're gonna palpate the apex of the heart, which is the apical pulse for presence and rhythm and amplitude. So, and it's present and it is regular 2+. So now you can go ahead and sit back up. Okay, so now we're going to auscultate. We're going to listen to the lung sounds. We're going to listen for presence and clarity, and if there's any adventitious lung sounds. We're going to use the bell of the diaphragm and do it for 1 full respiration. There'll be 8 spots on the anterior chest. Okay. And they are all present and there's no adventitious lung sounds. They're clear. And now we're going to listen to the heart sounds. We're going to start off with the diaphragm, listening for 10 seconds at the aortic area. This is the pulmonic. And then the Erb's point. And then tricuspid. And then mitral. Okay, and there we're listening for rate, rhythm, and presence of extra heart sounds, and there are not any extra heart sounds, and the rate is appropriate for her age with a regular rhythm. Now we're going to use the bell. It's for 10 seconds as well. Also listen for rate, rhythm, and presence of extra heart sounds. And this is the aortic. Pulmonic. Erb's point. Tricuspid. And then mitral. Okay, and the rate is appropriate for her age, regular rhythm, and there are no extra heart sounds. Now we're going to move to the posterior chest. We're going to inspect for symmetry, color, and configuration. We're also looking for color on the anterior chest. And we're also going to inspect the spine for any curvature, dimpling, or irregularities, and there are none noted. So then we're going to we need to palpate the bony structures of the anterior chest for bulges and tenderness. Tell me, and that'll be the clavicle, sternum, and ribs. Tell me if you have any tenderness. Okay, and there are no bulges. And with the back, we're gonna palpate the scapula, the spinous process, and the ribs. Do you have any tenderness? Okay, and there are no bulges. And we're also, for the anterior and posterior chest, we're going to inspect for the pattern and work of breathing. So it seems like it's pretty effortless and a normal pattern. Doesn't seem like she's breathing hard or anything. So now we're going to auscultate the posterior chest. With the diaphragm for 1 respiration. Okay, and lung sounds are present, clear, and there are no adventitious lung sounds. Now we're going to do the lateral lung sounds, starting on the right side because it has 4 points. There are 10 points posteriorly. There'll be 7 points laterally, 4 on the right side. Listening for presence, clarity, or adventitious lung sounds. Breathe in and out. Okay. Okay, the breath sounds are clear, present, and there are no adventitious lung sounds. And now we're going to assess the abdomen, so maybe lay back. Okay, and we're going to look from the side, we're going to inspect for contour, the shape, the color, if there's any pulsations, peristalsis, movements, and there's not. Then we're going to inspect for scars, lesions, vascularity, pulsations. And I don't see any. Everything looks normal. It's good color. Same as the rest of her skin. And we're going to auscultate, starting at the right lower quadrant for 15 seconds with the diaphragm. Okay, her bowel sounds are normal active, so now we're going to listen to her abdominal aorta in the epigastric region. And we're going to be listening for a bruit. I do not hear a bruit. And now we're going to palpate her abdomen for tenderness, masses, or guarding. So let me know if you have any tenderness. Okay, there's no masses. Do you have any tenderness? No. And there is no guarding. Okay, so can I go ahead and have you sit up? We're going to inspect the upper extremities, and we're going to inspect the arms, wrists, and hands for surface characteristics and color. I don't see any. And we're going to palpate for temperature. Temperature's warm. For texture, you have any tenderness? And moisture, skin is dry and smooth. We're going to also inspect the arms, wrists, and hands for symmetry, deformities. And then we will inspect the nails for color, shape, contour, consistency, texture. They're not too thin, they're not thick, and they're clear, they're clean, they're smooth, round. Okay, so now we're gonna do capillary refill. And they are less than 3 seconds bilaterally. We're gonna inspect for tinting. And her skin is elastic with no, or we're inspecting for turgor. Her skin is elastic with no tinting. Good turgor. We're gonna do the brachial pulses. And they are equal to plus bilaterally. And we're palpating for rate, rhythm, amplitude, presence. And now the radial pulses for rate, rhythm, amplitude, presence, regularity, quality. And they are equal to plus bilaterally. Can I have you do this? Okay, there's no clubbing of the fingers. We're gonna palpate for edema. There's no edema. Now, we're gonna assess for passive range of motion for limitations in movement, crepitus, or tenderness. Okay. We'll do Okay, you have any tenderness? There's no crepitus, and she had full range of motion. Now I need to do active range of motion. You do this, 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 and then this. Okay. And now I'm going to test for muscle strength. You put your arms up. Now pull, push, and squeeze my fingers. Her muscle strength is 5 out of 5 bilaterally. Now we're going to do the lower extremities, and we're going to inspect for color, symmetry, deformities, surface characteristics. There's no deformities, they're symmetric, even color. And we're going to palpate for temperature, they're warm throughout. Palpate for moisture and texture, they're smooth and dry. And do you have any tenderness? There's no tenderness. Palpate for edema. There's no edema. We're going to go ahead and get the passive range of motion for tenderness, crepitus, and limitations in movement. Okay, is there any tenderness? Okay, there's no crepitus, and she had full range of motion. And I need you to do active range of motion. Kick your legs out, back down, flex your feet, or extend them and then flex them, roll them around, your toes. Okay, so she has active range of motion. There's no crepitus, and she had full range of motion. And I'm gonna go ahead and get the capillary refill. She has polished. Well, let's first inspect the nails for color, consistency, contour, shape, size, color. And they're polished, white. That's white. And they're not brittle, they're clean. Okay, we're going to get the capillary refill and put on some gloves. So we can palpate those nails and get the capillary refill. Okay. Her nails are not brittle. They're good shape, they're rounded, smooth, clean. We get a capillary refill. It's less than 3 seconds bilaterally. Gonna go ahead and inspect the bottom of her feet for skin intactness and ulcers. There's not any. Her skin is intact. We're gonna get our posterior tibialis pulse for looking for presence, rate, amplitude, equality, regularity. And it's equal to plus bilaterally. Get the dorsalis pedis pulse. Also assessing for rate, rhythm, regularity, presence, amplitude. And they're equal 2 plus bilaterally. And now we're gonna test for muscle strength. Let's have you push your legs out and then in, okay, and then out and in, okay. Her muscle strength is equal, 5 out of 5 bilaterally. I'm gonna go ahead and have you stand up and put your arms out in front of you and squat down. And this is, ooh, there's some crepitus in her knees. And we're also assessing for balance, gait, mobility, and she's balanced. And now we're going to have you put your arms out in front and then bend down, or yeah, down, yeah, it's bend down. And we're gonna look at the spine for any scoliosis or kyphosis, and there's no curvature. Okay. And I'm gonna look at my note card now. Okay, I got everything. Thank you.